Good afternoon, ladies and gentlemen. Welcome to this presentation of preliminary results from a project that some colleagues of mine and I have been working on over the past 10 weeks as part of a class at Stanford on COVID-19 and the developing world. Our instructor, Professor Ashish Goel, was inspired to put the class together because, he noticed, or at least based on the requests that he got from India, that there was very little modeling happening around the coronavirus in the rest of the world. For a bunch of different reasons. And so we joined the class to sort of help meet that gap and collaborate with decision makers, academics in different parts of the world, and to really lend our talents, our skills, and our time to helping governments respond to this pandemic, which has upended everyone's life. I worked on the Botswana modeling team with my teammates, Claire Wilson and Jackson Ilas, both of whom are students in my Department of Management Science and Engineering. So we started the project really, without any sense of direction, because the key objective or the mission of the class was to assist decision makers with whatever modeling efforts that they had. So I think it was we spent most of the time in the beginning really trying to establish those relationships and trying to find interesting problems to work on, interesting problems to solve. And for part of the time in the beginning, we were contributing towards the COVID-19 scenarios model by the NEHA lab from the University of Basel in Switzerland. And we were helping them gather data for different African countries. But we focused specifically on Botswana, Rwanda, Ghana, and Tanzania. We have collaborated with different people at different levels and with varying levels of success. We will thank a lot of the people who have assisted us later on in this presentation. But the problem that ended up being the focus of our project was presented to us by the Presidential Task Force on COVID-19 in Botswana. And it is that problem that this presentation is going to be about. So even though I am giving this presentation, this is essentially the work of my team and I. So I'm just making this recording because one of the values of this class was transparency and this idea of sharing whatever insights and results we come out with the rest of the world. And a disclaimer before we proceed, these are whatever insights we'll present in this presentation. They are preliminary results, and they, we still need to work with our partners, the task force, to, really refine some of the assumptions that we make when we build this model, and to do some sensitivity analysis really around some of these results that we have. But without any further ado, I am going to begin the presentation. As I have mentioned, this presentation, this project was a collective effort between myself, Claire Wilson, and Jackson Ilas, and we were advised by Professor Bass from MSME department, and also, of course, Professor Ashish Goel, who was the instructor of the class. We are going to present, give some background and context, and then define the problem, walk you through the possible solutions that we considered to this truck driver problem, and share our preliminary results. And first, the background. So I think the first case, the first confirmed case of COVID-19 in Botswana was towards the end of March, and immediately thereafter, the country went into a total lockdown, with the exception of essential services, of course. And the clinical response team at the Sekiti Masire Teaching Hospital, which is where all the confirmed cases were being treated, independent, like regardless of the level of severity of the virus, they did a good job of really containing the virus. And the thorough contact tracing program that was implemented by the task force also really ensured that there was, they were able to crack down on any community spread or any, cases or clusters of cases that cropped up. And so by beginning of May, the country was in a position where they could reopen, and begin easing restrictions. Because at this point, borders were now closed to non-essential travel. However, sometime around May 11th, during the easing of restrictions, we started recording a lot of cases from truck drivers who, remember, even though borders are closed to non-essential travel, it is still very important to have essential goods being transported into the country. And so, the truck drivers who are responsible for this, we started catching cases of COVID-19 amongst them. And so this is a quick summary of COVID-19 to date in Botswana, which compared to many other countries, these numbers are really good. They're really, really good. So far, there's only been 42 confirmed cases in total. And out of those, 24 people have recovered, 16 have been transferred out. So these 16 are truck drivers who are coming from neighboring countries. So they've been sent back to their nations, and we have only recorded one fatality. So this means there's only one active case of COVID-19 in Botswana, at least as of June 8th. Some context about Botswana. Botswana is a country in Southern Africa, and it has South Africa to the south, Zimbabwe to the east, Namibia to the west and the north, and we share a little border, or at least a very short border, with Zambia. But really what is important is that, Botswana is a part of the Southern African Development Community and the Southern African Customs Union, and both of these organizations have trade agreements, and one of those agreements is they have shared road infrastructure, to deliver goods. So part of the truck traffic really that is coming into Botswana, through these 11 or so borders, comes into Botswana to deliver goods, but some of it is a transit traffic going to countries such as Zambia, Namibia, and Zimbabwe, delivering various goods from South Africa. So it is not an easy, or it is not feasible really to close those borders to this kind of traffic. So which really brings us to our problem, which is how should Botswana respond to the potential COVID-19 propagation through truck drivers? So this is the problem that we really looked at. And we explore three possible solutions. Really, the first solution is to do nothing. The second solution is what we call isolated operation. We'll go into greater depth into it later. And the third solution is driver exchange, where trucks exchange drivers at the border. The first strategy, do nothing, really, this is simple. Truck drivers are allowed to enter the country, do whatever they came to do, and leave without imposing any additional restrictions on them. But remember, Botswana has more or less, gone out of its lockdown. I mean, there's still People still need permission to travel between what are called COVID zones, but except for that, life in Botswana has relatively returned to normal. So as you can see, the truck drivers in this diagram are red to really highlight the fact that they are, very risky in terms of COVID-19, like bringing in COVID-19. And then the essential workers in this diagram refer only to workers who work with the truck drivers. And they are orange, because they interact with truck drivers. Therefore, they have some risk also of being caught with COVID-19. And then, of course, the rest of the population is not entirely safe as well, since, in fact, in one of the cases, one of the truck drivers came into contact with 568 people when they did the contact tracing. So really this, this strategy obviously is just a base case, and we wouldn't recommend it at all. And even our results later will show it. But really before going into these, we want to, share at least the theoretical framework that we are using for this model. And I'm sure a lot of people are now familiar with SIR models, especially since COVID-19, because a lot of people have been reading about these things. But just to really, explain it, one of the ways through which, we can model the dynamics of a disease is using an SIR model, which basically divides a population into 3 groups. The first group is susceptible. The second group is infectious or infected group. And then the third group is the recovered group or the removed group. And in that group, it also includes, people who have died because they've been removed from this population. And sometimes the SIR model might have a reinfection, which means people who have recovered might be reinfected again. But for COVID-19, we really don't know if people get immunity or if they can get reinfected. But for our model, we assume that there is no reinfection. And really, we extend that basic SIR model to build this relatively complicated model, which divides our population into 3 subpopulations. So we have the truck driver population, the essential workers population, and the rest of the population. And for each of these 3 subgroups, we have the susceptible pool, the infected pool, and the removed pool. And then in this model, we also include a separate category for deaths at least. And really, because the objective of the task force is to minimize, the expected number of COVID-19 deaths. And if you look at only the black diagram, it is a Markov model, really to capture the fact that this is a time-based model, and Markov models, our Markov chains really are one way to model, these kinds of dynamic systems. And then the red diagrams represent the interactions between the different groups. And as you observe, these interactions are between, the infected group and the susceptible group, because that is how the disease is transmitted, right? And the diagram really, we have not included all of the formulas and equations on the diagram that captures the model dynamics. And for part of it is just really so that the diagram is readable. But I hope that it makes sense as it is. And because we assume there is no reinfection, the probability, given that an individual gets to the removed recovered group or the dead group, the probability that they will stay there is 1 because they cannot get out, at least according to our no reinfection assumption. And so you remember, strategy 1 is do nothing. Strategy 2 is the isolated operation, right? So really in the isolated operation, we are creating an artificial boundary between the truck drivers and the rest of the population. Of course, truck drivers will still need to interact with essential workers at the border because, at the border, there are all these immigration and customs formalities that must take place. And then if they are delivering goods into the country, they have to interact with the employees who are receiving the order because, just to verify that, the order was like everything that they brought was delivered and sign off on that. So to some degree, at least we assume that that interaction cannot be, eliminated. And then the other thing, and this one really came up from our conversations with truck drivers in Botswana, which was they also need access to food, restrooms, and other rest services, especially, when they are transiting through or like on these really lengthy journeys. And part of the reason for that is that because of customs regulations, they are not allowed to come into the country with some food, or at least with certain food items. And so either way, so it is not feasible for them to pack their food from, South Africa or wherever their point of origin is into the country. Unless, of course, if there are special exceptions made, under the ongoing state of emergency in the country. But for now, we just assume that, those rules stay in place. But as you can notice here, the truck drivers are still red, because they're very at risk of being testing positive for COVID-19. The essential workers are still orange because they're still interacting with the truck drivers. But now the rest of the population, they're very green, which means if we assume that, all cases of local transmissions in the country have been identified and contained, then we assume that the rest of the population is safe for as long as we can guarantee this corridor, right? And so obviously this affects the values of the parameters in that, generalized. So this really affects the values of the lambdas in this generalized model, right? So based on the interactions. And now, another key assumption really, or at least one way of enforcing this boundary is to separate the essential workers from their families, right? And so obviously this raises, questions about feasibility of this strategy, because you have to ask these essential workers to make the sacrifice of living away from their families for weeks at a time. And then when they are done with this, shift after a few weeks, for them to be able to rejoin their families, they first have to undergo a 14-day quarantine, and after which, if they test negative, then they are free to rejoin the rest of the population. But of course, this presents a lot of, implementation challenges in that regard. However, this also makes it easier because now you are able to direct all the testing resources towards the truck drivers and the essential workers, right? And in this case, it becomes easier to do contact tracing because every time you catch a case, it's easier to know, okay, this truck driver interacted with these essential workers at these places. Because the population of essential workers is a significantly lower subset of the population of everyone else, right? So already this has potential to be better than the base model in that regard. And then the third strategy that we explore is the driver exchange. And really, this is the idea that, you have, one subset of truck drivers stay outside the country, and then another subset of truck drivers stay inside the country. And so basically what happens is, the truck drivers from outside, they drive the truck up to the border, and then the truck drivers from inside now take the truck into the country and then drop the goods off, or if it's transiting to the other border on the other side, and then same thing happens on that other side. And of course, we assume that, there's some disinfection of the trucks in between drivers. But of course, that disinfection does not completely eliminate the risk of transmission, but it decreases it. So in this case now, because at least as of right now, Botswana's neighbors, they have far more infections than Botswana itself. So we consider that drivers on the outside, or at least coming from the outside, or who are presently outside, are more at risk of contracting COVID-19. And then in this model, that would mean, the truck drivers that are exclusively inside the country will have a comparatively lower risk, right? And that there is still some risk because obviously the disinfection is not completely perfect. And then the essential workers have a reduced risk as well, because now the truck drivers that they're interacting with are the local truck drivers. And then the rest of the population, even though they are still interacting with all of these truck drivers, the rest of the population, they are not able, their risk is reduced rather, excuse me. And yeah, so now in this model, we're able to preserve sort of these freedoms that everyone is enjoying right now. But so really now what this means, right, is now we have these three different models. They have the same, model formulation. The only thing that differs now is the parameters of these different values in the equations that we have, right? And we used Vensim, which is a software that is really good at modeling dynamic phenomena. And since this is also a dynamic phenomena, we really use this. And we are really grateful to Kiran, who helped us to implement our model in Vensim, because it is a piece of software that our team was not familiar with. But he was really generous enough with his time and talent to help us, and which is really one of the things that have been great about this class and this project, is that there has been a lot of collaboration between the different teams. And in fact, even some of these strategies are based on the work of other teams. So we basically simply just built on top of their work and adapted it to our specific situation. So we're going to present our preliminary results, but really, we shouldn't read too much into these results. But I still think that, we can get some insight from these results. So strategy 1, remember, is do nothing. Strategy 2 is that isolated operation. Strategy 3 is the driver exchange. And as I mentioned, the parameters of these, the only thing that differs in the general model is the parameters that go into it. And here we, this table below really tries to capture that difference in these parameters. But of course, it is important to realize that, these parameters that we input into this model are really our best guess estimates right now. And of course, as more data becomes available related to COVID-19 and including the probabilities of infection and R0 figures and all of those other different things, we'll be able to get more precise results. And really the key insight, if we look at the graph, is we notice that, when we do nothing, we reach the peak number of COVID-19 deaths pretty quickly, or relatively quickly. And then if we do the driver exchange, there's like a slight delay, maybe by, some time periods, but it is also not significant. But if we look at the isolated operation strategy, so this is really where we only, focus all our testing efforts into, the essential workers and the drivers, because we are able to isolate them. And so contact tracing becomes easier. This is why, so there's a delay in reaching the peak. And really the key thing, or at least the key assumption about this model right now is that there is no cure, right? And so, which is why all of these graphs ultimately lead to the same number of peak deaths. But right now, the world is striving to get a vaccine for COVID-19. And once that vaccine is out there, right, obviously this can cap, the maximum number of deaths. So it is really crucial, to find an intervention strategy that delays reaching the number of peak deaths, at least. And in this case, we observe that it is the isolated operation, right? So this is the strategy, for that would ensure that at least that delays the, reaching the total number of deaths. And of course, these are preliminary results, and there's a lot of work that we need to do to refine the model so that we can get results that we can trust. And also we need to, talk with our partners on the Presidential Task Force to see, what other things we can consider for feasibility and the like. But I mean, we feel confident by the general insight really that we drew. And from the presentation that we gave in the class, we got really positive feedback, especially about the generalizability of the problem, not only to truck drivers, but also if you want to think about, little communities that you want to keep isolated, but within that community you want to continue, life to continue relatively normal. So, you can also explore some of these, choke point based strategies. But yeah, this is our presentation. And we are especially grateful to all these individuals who have helped us really, be it through making introductions to people who can help us, or helping us understand the situation much better on the ground. So we are really, really grateful to their assistance, and that is our presentation. So thank you, and hopefully this has been insightful, and other people can maybe build on top of it, or give us feedback on how we can improve our model. So thank you.